Hi. This morning I thought I'd do something on unhelpful thinking styles. One of the early things that I can sort of pick up when I'm in a therapy situation is the way that people language, and their language tells me quite a lot about their thinking styles. So I thought it might be helpful to do something on that. The first one, there's 10 that are really common unhelpful thinking styles. And it's good to remember that, whatever we've used in the past, we've used it for a reason. We've found a way of making that useful to us. And but again, I've said this before, that when people are in my room, all the things that might have been useful to them in the past are no longer working for them. And so they're looking for an alternative. And if the way that they language and their thinking style is something that we can actually deconstruct, we can usually find out, why they thought it was helpful in the first place and what else they can do, what they might be able to do to change that. So I thought I might do maybe 3 in this session. But anyway, the first one is all or nothing thinking, it's called. And that's black and white thinking, kind of it's my way or the highway thinking. Um, and it means that there's it's quite rigid and there's no middle ground. And that is a sort of fear-based way of thinking, because it keeps you safe. It's sort of clean. It's like there's we in academia we used to talk about linguistic hygiene, and there is something about personal linguistic hygiene that I think is really helpful, but we might come back to that. Anyway, we use it as a way of just sort of feeling confident and feeling clear about something, and I think that sometimes if it's not working, or say you make a mistake, you're a black and white thinker, your brain will actually have done, right, that mistake was a terrible thing, so if you're not perfect, you're a terrible person. So there's kind of no middle ground there. There's no sort of like, okay, there was a context for that mistake. Anyhow, so that is that unhelpful thinking style number one is black and white thinking. And originally it would have been, a kind of really helpful in evolutionary terms, like, one wrong move and you're dead kind of thing. So we can get into that black and white stuff. But every individual, and if you're interested in psychoeducation, it's because you want to actually think about what changes you can make, and changes that will make a big difference to you. So that's all or nothing thinking. That's the first one that I've written down this morning. Second one is catastrophizing. Now, who doesn't love a good catastrophize? Which is just really when you magnify things, you magnify what the potential outcome is. So you do that what if, and you create a sort of huge Hollywood type narrative out of a fragment, and so it just you're amplifying, you're magnifying, you're making something bigger, and often without any evidence to do that. But the brain loves that. It loves that creativity. So it's really common. So and that can be something which actually begins to really occupy you, because once you create a story, you start getting into a series. So if you can prevent yourself from actually really looking at what your evidence is for that amplification, and I mean, the brain is brilliant at actually finding evidence. It'll go in search of evidence for it, and you might be able to. But if you've got somebody around you who can check you, whether it's the therapist or not, doesn't really matter. But anyway, it's really unhelpful because it occupies your brain, and you're in the sympathetic bit of the nervous system when you're catastrophizing. You're creating a scenario in which danger is imminent. So you want to be able to sort of curtail that if you can. Now, we would have used that originally as a kind of threat detection. We've all got our sympathetic nervous system as a threat detection system. So if there's a tiger in the car park, you want to be anxious. You want to be able to be in fight, flight, or freeze. It's really important to have that as a possibility that you're going to survive if you're using that. But we've become sort of we kind of misuse it, I think. Now there's lots of opportunities for us to actually misuse it, so just be cautious about that. If you are kind of in anticipation of a problem, actually keep doing a kind of reality check about what is realistic about that. Anyhow, right, so that's number 2, catastrophizing. And number 3 is emotional reasoning. And that is that because you think something, it must be true. And that is absolutely not the case. Lots of times we do that as we call it this means that sort of thinking, and it isn't the case, and we haven't got any evidence for it, but it doesn't stop us from thinking and acting on it. So anxiety is something which is visceral. It's got sort of in your body, and so we love to reason with it, finding a way of actually creating something which is not an absolute, but it's kind of gives us a reason for it. So that's why it's called emotional reasoning. Anyway, I think originally our thoughts and our emotional state is a signal to us, and that's really helpful. But now, and certainly with social media, and when we're on a kind of often on a loop of being in our sympathetic nervous system, because there's lots of stuff that feels uncomfortable or worth challenging. Anyway, so be cautious about your emotional reasoning. I'll do another couple actually, if that's okay. Mind reading. This is lovely. So we actually call it crystal balling, so that you actually really genuinely believe that you know what someone else is thinking about you. And how can that be? You can't. They're thinking about their tea. They're not, or whether they're going to make it to the match or whatever. There's a sort of arrogance about mind reading, which is that you are the center of the universe, and you are the center of your universe, but you're not the center of everyone else's. But we do that kind of, they must think I'm this, or they must think I'm that, and this, I know that they hate me, and I know that they used to love me, or whatever. And that is a really unhelpful thing to do for yourself and for the people around you. And actually, it might have been helpful at some point if you were, instead of thinking, I know what they think, if you were to be able to be curious about that rather than and say, I wonder what they do think. You're in a completely different zone in your brain and in your somatic recovery if you can do that. So that's mind reading. Easy on the mind reading. And then the next one is shoulds, oughts, musts, have to. I've talked about this a wee tiny bit in another video. We call it compulsion language. And in my background, where the superego played a really dominant role, the superego is a place where all the voices from significant people in your life have kind of landed and begin to drive you. They become sort of driven by those things. So if you were a child that understood that if you behave in a certain way, then your needs would be met, or you wouldn't get hit, or you wouldn't get kept in, or whatever it is, you start to become somebody that really toes the line of the shoulds, oughts, musts, have to. It's very dutiful language. It's a language which is not rebellious. So you've built yourself around shoulds, oughts, musts. So if you hear yourself saying, I should do that, or I have to do that, if you can swap that out for I'd like to do that, then that is, you're in a different bit of the brain. and you're not perpetuating something in the sympathetic nervous system, which is you doing something you actually don't want to do. Now there are good shoulds. I know that you know you shouldn't kill people, you shouldn't sleep with your neighbour's wife, or you might do. But anyway, you get the picture that it's compulsion language. So I've got to, I have to, I must, I ought to, I should. Those are all again, sort of being for others way of languaging. So be cautious about your should statements. And there's another wee sneaky word that I hear again. I had, I've had patients this week. I had one, and I sort of, when I get to 50, I've kind of lost count and lost the will to live almost, because they say try. We all say try. I'll try and do that. I'll try and do that. I'll try and do that. And try is a fabulous social softener. And when we're in a vulnerable, this is all the stuff that I'm doing on these videos is about when the stuff that you've been doing no longer serves you. If you're happy and you're ticking along, you can language whatever way you want. Don't listen to any of this nonsense. But if you are vulnerable, if you've kind of reached a state in which things are not working for you the way that they used to, and you are looking to change stuff about yourself, then this stuff, small things can make big differences. So if you're in the kind of the try zone, then your brain is already in doubt. If you do try instead of yes or no. So I'm in the linguistic hygiene place of keep your language clean. If you're in my room, if we start to clean your language, so you say yes or no. You don't do any of that havering, trying bit in the middle. When we try, if we say, right, I'm going to try and get along to that, what we're actually not saying is no. You'd like to say no, but you don't say no because you're worried about offending somebody. Now that's a being for others kind of psychology. So you're privileging somebody else's needs over your own. And what happens in that case is that little try takes up space all week in your head until you're able to email them or text them or something and say, actually, I can't make it. So if you ease up on that kind of language, then it's going to free up space in your head and reduce your anxiety. So those are the 5 shoulds, oughts, musts, mind reading, the sort of overgeneral. No, that's the wrong one. I've got the wrong one. Never mind. I'll come back to the other ones.